In this next video, we are going to classify the major types of leukocytes and describe their structural features and immune functions. We're going to explain the ABO and RH blood group systems and describe the causes and consequences of transfusion reactions. So we'll start our conversation with focusing on white blood cells are anatomically referred to as leukocytes, and they are the special cells in your body that help protect you from infections. They are the only formed element with nucleide organelles, and they make up less than 1% of your total blood volume. Now, they have a very interesting way in which they move through our blood vessels and capillaries. They do this through a process called diapedesis, which is like squeezing through tiny spaces to get where they are needed. And once they're outside, they can typically move around through the tissue spaces using a method called the amoeboid motion, and which is they move in the way like an amoeba, okay, by stretching out and then pulling themselves along. They also follow signals from the body in a process called positive chemotaxis, where they move toward areas where they are needed most, like where there's an infection or injury. This, all in all, helps to protect your body from infection and fight off sicknesses and to be able to heal. So leukocytes are going to be grouped into two major categories. We have granulocytes, which are the white blood cells that feature these granules within their cells, and these granules typically have proteolytic enzymes or other special enzymes that can help break down and breach the integrity of the walls of the pathogens or bacteria, whatever it is they're fighting. And then we have the agranulocytes that do not contain the visible cytoplasmic granules. So when you look at their cytoplasm, all you see is the organelles, and that's it. You don't see these little dots that you see when you're looking at a granulocyte. Take a moment, pause the video, write down the mnemonic to remember the concentration in terms of the decrease in abundance in the blood. Never let monkeys eat bananas, okay? And so although we haven't introduced our white blood cells yet, the different types, we will right now just for the sake of this mnemonic. Never corresponds to neutrophils, let corresponds to lymphocytes, monkeys corresponds to monocytes, eat corresponds to eosinophils, and bananas corresponds to basophils. Again, take a moment to write this down in your notes so that you have it when you need it. All right, so let's look at, because we've talked about the first 3 points, but let's look at the types of granulocytes and agranulocytes. We have neutrophils up first. Neutrophils are the most abundant type of white blood cells, and they are typically the first to respond to infections, particularly bacteria. And basically, they act. They're phagocytic. They engulf and destroy pathogens through a process called phagocytosis. Okay. Basophils release histamine during allergic reactions and inflammation, and their whole goal is to help promote blood flow in the immune response in the affected areas. Now, eosinophils are involved in fighting the parasitic infections and play a role in allergic reactions by releasing substances that can damage parasites or promote inflammation. Now, lymphocytes make up 25% of the total white blood cell concentration. They are an agranulocyte. They're typically going to be found primarily in lymphoid tissue. There may be a few that circulate in the blood, but they play a key role in the immune system by recognizing and attacking harmful invaders like viruses and bacteria and abnormal cells. We have 2 types of lymphocytes. We have T lymphocytes, which are T cells. They're going to act against virus-infected cells and tumor cells. And then we have B lymphocytes, or our B cells, that are going to give rise to plasma cells, which produce antibodies. We have monocytes, which in terms of their size, they are the largest leukocyte but in terms of their concentration, they're on the lower end, okay, representing only about 3 to 8% of all white blood cells. They are agranulocytes. They have the ability to leave circulation into our tissues and differentiate into macrophages, where they can pretty much engulf and destroy pathogens by way of phagocytosis. They can also activate lymphocytes to generate an immune response. Now, before we move on, I want us to kind of recap kind of what we've touched based on, okay? There are two different groups of leukocytes. We have our granulocytes, and that includes our neutrophils, our basophils, and our eosinophils. We have our agranulocytes, A meaning not or without, so they don't have granules in their cells, and those include our lymphocytes and our monocytes. When we look at the relative concentrations of them, the neutrophils are going to be the most abundant. We're going to have the highest concentration of neutrophils, followed by our lymphocytes, okay? After our lymphocytes, our next most abundant white blood cell is going to be our monocyte. And then our next white blood cell would be our eosinophils. And then our white blood cell in least concentration circulating throughout our blood is going to be our basophils, okay? And so use your mnemonic, never let monkeys eat bananas, to help you remember the concentrations of these white blood cells in order, okay? Leukapheresis is the process that describes the production of white blood cells. It's going to be stimulated by chemical messengers from the red bone marrow. In mature white blood cells, just like all of our blood cells, they are going to originate from a hemocytoblast stem cell. So probably my favorite conversation to have is about blood typing, and is something that I enjoy doing in the lab. It's really cool. And I think it's one of those things that once you get it, you get it, you know. So I hope that you get it. And so let's jump into it. All right, so humans have at least 30 naturally occurring red blood cell antigens, okay? And remember, antigens are just those markers that on the cell that let the body know kind of what belongs to the body and what doesn't. And so we can use the presence of these antigens to classify blood cells into their groups. Now, the antigens of the ABO and RH blood groups are the ones that we typically use to classify our blood types, and that is primarily because they cause strong transfusion reactions. We have the agglutinogen, which is going to be the antigen. This is the thing that triggers the response. And then we have the agglutinin, which is the antibody. This is the thing that reacts against our foreign agglutinogens. Now, the MNS, the Duffy, Kellum, Lewis blood groups are less common blood group antigens. They are weaker antigens compared to the ABO and RH blood groups, so we don't typically use these to type people. We only type them for patients who will need multiple transfusions, so like in situations where they have chronic anemia or sickle cell disease or bone marrow transplants. Repeated exposure to these minor antigens for these particular patients can potentially cause a reaction, and so that's why for these patients we do pay a little closer attention to these weaker antigens, but for most individuals we're just going to use the ABO and RH blood groups to determine their type. When there is mismatched blood infused, a transfusion reaction could occur. And this is a serious reaction where the individual that is receiving the cells, their antibodies attack the cells that they receive. And so it can cause like agglutination, where you have like all of the cells come together and clump up, which could block some smaller blood vessels. Or you could have the antibodies that kind of attack and kind of rupture the membrane, causing the release of hemoglobin into the bloodstream. And this is going to result in the diminished oxygen carrying capacity. Blood flow is going to be reduced in the vessels that are blocked, again diminishing the amount of oxygen that can be carried to those tissues. Hemoglobin in the kidney tubules can lead to renal failure. Transfusion reactions are very serious. And when you have a homeostatic imbalance, especially when you have these cells that are just attacking the cells that your body needs to use, it could be fatal. It could result in death. So how do we determine blood types? Each person is going to inherit 2 genes from mom and dad, one from mom, one from dad, that control the production of our ABO groups, okay? So if you have type A blood, you either inherited the A gene from mom and dad, or you inherited the A gene from mom and the O gene from from dad, okay? If you have type B blood, that means you either inherited both B genes from both parents, or one parent had the B gene and one parent had the O gene. If you have type AB blood, the only way that you can have type AB blood is if you got the A gene from one parent and the B gene from another parent. And if you have type O blood, then that means that your parents had neither the A gene or the B gene, okay? So that's why you have O, okay? So think of it as like 0. You don't have either. You don't have A or B. You just have O, okay? To determine an individual's blood type, we typically test it with the serum and see if agglutination occurs, and by agglutination we mean clumping, okay? And so on your screen, this would be an example of clumping. That's clumping, that's clumping, and that is clumping, okay? Everything else that's smooth would be considered to be smooth. There's no agglutination, there's no reaction, okay? So an individual that has type AB blood is going to interact with both serums, and so you see agglutination, all right? And before I go through each one, I will go ahead and give you kind of a side note. If it agglutinates, the antigen is present, okay? And I'll say it again. If there is clumping, then the antigen is present, okay? So we see here we have clumping, so we have AB blood, all right? I have clumping on A but not on B, so this individual has A blood, okay? I have clumping on B but not on A, so this individual has B blood, okay? And I have no clumping in either well, so this individual has type O blood, okay? All right, so another group of antigens that could be found on the red blood cell that we use for blood typing is called the Rh factor, or as you see on the screen, it is referred to as antigen D, okay? So the Rh factor and antigen D are the same thing. Please make that note in your notes, all right? If you are Rh positive, then you have the D antigen. If you are Rh negative, then you do not have the D antigens, okay? Now, the Rh group of antigens are a group of antigens that our body does not create or that we're not born with antibodies for, okay? So, for example, if I have type A blood, then I have antibodies in my body right now against type B blood, because if you put type B blood in my body and I have type A, then we're going to have a reaction because my body doesn't recognize type B blood. So there are antibodies against type B blood, okay? That is what I am born with. The Rh factor is a little different because you don't develop antibodies until you've been exposed to the antigen, okay? Many people may not know until after, the second interaction with this particular antigen that they have antibodies against it, okay, unless they do a blood type lab and they just know ahead of the time. Now, when talking about expectant mothers, this is kind of where, the development of antibodies at their prior exposure can be significant. Unlike the ABO blood groups, the Rh does not have preformed antibodies against this counter antigen, okay? So the Rh negative person who receives Rh positive blood will soon start making antibodies after the exposure, okay? Because the individual that is Rh negative, to mix Rh negative with Rh positive, that is a mismatch. So the person that's Rh negative their antibodies are going to attack the Rh positive cells. Okay. Now, hemolysis, where the cells are attacked and broken apart due to exposure to a foreign antigen, in this particular case does not happen after the first transfusion because it takes a while for the body to make the antibodies. But better believe that the body will be ready if transfused again, which is why Rh negative moms who suspect they may be having a Rh positive baby are given a shot called RhoGAM, containing anti-Rh antibodies to prevent the mom's antibodies from crossing the placenta and destroying the cells of the developing baby. Okay. Let's think about transfusions. Now, whole blood transfusions are used only when blood loss is rapid and substantial. It is not routine. Most transfusions are usually only components, okay? And so we have infusions of packed red blood cells where we have the plasma and white blood cells removed, okay, to restore oxygen carrying capacity. In blood banks, they're going to separate donated blood into components. The shelf life is roughly about 35 days. And this is done to kind of reduce the risk associated with transfusing parts of the blood that's not necessarily needed for that individual, because it increases the risk when we do so, okay? And remember, transfusion reactions can be fatal. And so one way that we try to kind of prevent that is by blood typing. You know, before transfusing blood into a recipient, knowing the recipient's blood type and matching it with the donor that's going to transfuse the blood, okay? One situation where we see an increased risk is a condition called TRALI, where it's transfusion-related acute lung injury, and it's rare but serious, and it's caused by antibodies in donor plasma from women who were pregnant. So their body made these particular antibodies during pregnancy, and when whole blood is donated, everything is donated. Remember, the antibodies, everything, and so those antibodies, when donated to the recipient, can cause the recipient to have some severe lung problems. It can lead to fluid buildup in the lungs, and that individual can have some pretty serious respiratory distress. So if we don't have to do whole blood transfusions, it is preferred to just donate the parts that are needed. All right, so here are your questions for this video. The next video we'll talk about hemostasis and the process of blood clotting. Okay, as always, if you have any questions or you need additional support, please do not hesitate to reach out.